My name is Jean-Michel Molina. I'm a professor of infectious disease at the University of Paris in France, and I'm also the head of the Department of Infectious Disease at the Saint-Louis and Lariboisière hospitals in Paris. Today I have spoken about a controversial issue, which is the use of antibiotic prophylaxis to prevent STDs, and in particular bacterial STDs, chlamydia, gonorrhea, and syphilis. You may know that worldwide there is a huge increase in STDs, especially chlamydia, gonorrhea, and syphilis. And this is a concern because these STDs are associated with significant health problems, and I would say in particular syphilis, with the resurgence of congenital syphilis in newborns, which is a big issue. And also chlamydia and gonorrhea can induce in women infertility, pelvic inflammatory disease, and issues during pregnancy. So we really need to do a better job in preventing these and reducing the rate of STDs. So to do that, we have a number of tools that can be used by people to reduce their risk of STDs. Condoms can be, of course, used, and we should continue to reinforce the use of condoms. We could also ask people to maybe change, if possible, their sexual behavior in reducing the number of sexual partners, but this doesn't work so well. We could also try to better diagnose and treat STDs, because if you can diagnose STDs earlier enough, treat these STDs, you can prevent transmission to your partners. And we have now very good diagnostic tools for STDs, so it's important that people who have sexual partners should be tested for STDs even if they are asymptomatic, because 2/3 of the STDs are asymptomatic infections. We should also try to make treatment available for partners of people who have STDs, so that their partners are aware of their STDs, and we can write prescription for the partners as well to try to avoid transmission of STDs to even more partners. We can try to develop vaccines, but vaccines for bacterial STDs are not yet available, and that's why antibiotic prophylaxis, pending the availability of vaccines, could be a strategy. This is not a new strategy because it has been tested since the 1940s after World War II to try to prevent sexually transmitted infections, bacterial infections in particular, but it has been abandoned because this prophylactic strategy was targeting gonorrhea in the past. And gonorrhea is a bacteria that is really quickly able to develop resistance to any antibiotic you would use to prevent, and that's why it was abandoned. But for chlamydia and syphilis, what is remarkable is that these two bacteria are not able to develop so quickly resistance to antibiotics. And for example, we have been using penicillin for decades to treat syphilis, and syphilis is still fully susceptible to penicillin. The same is true with chlamydia and tetracycline. We use doxycycline to treat chlamydia, and chlamydia has been unable to develop resistance to tetracycline up to now. And that's why we started to think again about the use of antibiotic prophylaxis for chlamydia, syphilis, and also gonorrhea when we completed our PrEP trials to prevent HIV in men who have sex with men, because in people using PrEP for preventing HIV, and PrEP is very effective, we've seen a high rate of STI. And we said this population of MSM using PrEP and having a lot of STDs is an ideal population to study new strategies to prevent STDs. And we thought that doxycycline could be a good strategy because doxycycline is not frequently used to treat community-acquired infections. It's mostly used for malaria prophylaxis or for treatment of acne, and we have other ways to treat these diseases. So we designed in 2016 a study to see whether post-exposure prophylaxis with doxycycline, giving people 200 milligrams of doxycycline within 24 hours after sex, between 24 to 72 hours, to see could prevent STDs. And guess what? It was very effective. Using doxycycline post-exposure prophylaxis in people on PrEP, we showed a 50% reduction in the incidence of STDs. And the reduction was even greater for syphilis and chlamydia, with reduction by 80%. And so this was a very provocative result. Of course, we had some concern about whether or not this strategy could induce resistance, whether its effectiveness could be confirmed in other studies. And recently, a similar study was conducted in MSM in the US and found similar results. Very high reduction of incidence of STDs, nearly 80% for syphilis, chlamydia, and 50% for gonorrhea. And we have recently conducted a similar study in France again, And we confirmed this high effectiveness of doxycycline post-exposure prophylaxis in men who have a high rate of STDs. So now the question is, we know this is working well, the effectiveness has been confirmed. How to use it best? Because we know that antibiotic prophylaxis can eventually lead to antimicrobial resistance. So we have to be careful, and we have to really identify the population who might benefit the most from this strategy. And we need to monitor people who use doxy prophylaxis to make sure that doxy resistance will not emerge, in particular in chlamydia and syphilis. We already know that gonorrhea has developed resistance to doxycycline. So in France, for example, 65% of gonorrhea isolates are already resistant to doxycycline. So it's not a major issue because this strategy is not really intended to prevent gonorrhea, but more to prevent syphilis and chlamydia. And of course, so far, syphilis and chlamydia are fully susceptible to doxycycline. So that's why also it's so effective. So now the idea is to see how this strategy can be implemented. In San Francisco, for example, now they have decided to implement doxy-PEP in MSM using PrEP. There are guidelines, international guidelines, who are more cautious, saying that this strategy could be used on a case-by-case basis in people who have a number of STIs, who have multiple STIs. So we have still to define in the future who should benefit from this strategy, how to prescribe it, how to monitor this strategy, and to see whether you would induce resistance or not. So it's the beginning of doxy-PEP being used for people who have a lot of STIs. This is not only for men, it could be also used for women, of course, but we don't have still good data in women at this point. But so we need probably to do more studies in the future. This is one strategy. To prevent STDs, you need to combine strategy: condoms, better diagnosis, immediate treatment, antibiotic prophylaxis. So you may want to combine all these tools, waiting for vaccines to be available. Thank you.